Hello and welcome back. This week we'll be discussing Chapter 4, where we're talking about ethical and legal perspectives, and Chapter 10, where we're talking about service coordination. So when we talk about ethical and legal considerations, we're talking about following those ethical principles, those Kitchener's models of ethical and moral behavior, right? The first he talks about autonomy. That's helping our clients grow, helping our clients become more independent, helping our clients actually make decisions on their own and be able to formulate ideas on their own or whatnot, so they're able to utilize those skills in real time, right? A lot of times, some services can create a level of dependence for a client to depend on that service to survive, or depend on that service for their needs or whatnot, and it causes the clients to actually limit their efforts, right? Which limits their ability to become autonomous, right? So we want to ensure that our services are creating autonomy and also respecting the client at the same time and whatnot, but helping that client get to a point where they have some feet in it and they were able to provide for themselves without the need for their service. The next principles he talks about is beneficence and non-malfeasance. Do no harm and do good for clients, right? We can harm our clients by creating dependence. We can harm our clients by inappropriate relationships. We can harm our clients by abandonment. We can harm our clients by not being consistent or following through with the services that we're providing, right? Those things would be non-malfeasance, doing harm to clients. Beneficence is doing good. We want to help our clients actually reach their goals by following the moral principles that we're discussing, right? We want to make sure that our clients are benefiting from our services and that they have appropriate relationships and they're learning how to have appropriate relationships through us as models, as being a provider. The next one is justice and fairness. Now, when we think about justice and fairness, a lot of times the word equal or equality comes into play, right? Well, I want you to focus more on equity, right? Or being equitable, right? Being equal means if I had a room full of people, I would provide everyone in the room a size 10 left shoe, right? Now guess what? Everybody in the room doesn't wear a size 10, right? But it's equal. Everyone's getting the same thing. But to be equitable, I'm giving everybody what they need, the size they need that's appropriate for them, that fits them, that's something that's going to benefit them. That's equitable, right? Because again, everyone doesn't have an equal amount of needs or equal amount of responsibilities or need an equal resource, right? Everyone's situation is their own resource, right? And fidelity, being dependable, being loyal, being trustworthy, right? And respond to our clients in a manner that's going to benefit them and not benefit us, right? So those are the core ethical principles that we want to follow through all our interactions with clients. Professional boundaries, really important, right? Especially talking about incorporating those moral principles that we discussed, right? We want to avoid having dual relationships that can actually muddy the waters in that therapeutic relationship or that case manager relationship that you guys are having, right? You want to make sure that everything is concrete and you're not operating in multiple different roles that can confuse the client or harm the client. Maintaining confidentiality. Again, first off, explaining what confidentiality is to our clients and the limits of confidentiality, right? Because there are limits. Again, when a person's harming themselves, someone's harming them, right? Um, those are times when we have to actually report those things. Also, court orders, right? Subpoenas, those things can come into play. Supervision, um, treatment team consultation, all times when confidentiality or certain parts of a person's PHI can be discussed, right? And respecting cultural and personal values. Again, we want to make sure that we're individualizing each person, not putting anyone in any box, and making sure they're getting being treated for their individual selves and respecting their cultures and their belief systems and their values. So legal consideration. You just talked about confidentiality. That's a part of our informed consent, informing our clients about what services we're going to be providing, the limits of confidentiality, informing our clients about how we're going to deliver our services, where we're going to meet. They have a right to consent to the manner in which we're going to treat and where we're going to treat, right? So they need to have a broad view of or scope of all the services that are going to be provided, so they can say no or they can say yes to those services. Mandated reported laws. Again, explain our clients when we're mandated reporters, when we have to report if someone's hurting them or they're hurting somewhere else, right? Or they're hurting themselves. Those are times when we're gonna have to breach confidentiality to make sure everyone's safe, right? So again, helping clients understand those things or whatnot are very imperative legal considerations. Documentation ethics, accuracy and timeliness. Again, making sure that we're accurate in our documentation of our services, maintaining that record, and we're being completing those documentation in a timely fashion. Because again, most insurance companies or agencies want you to respond and complete the documentation of the services that you provided within 24 hours to make sure that it's accurate, to make sure that it's consistent to what you did and how the client responded, and is an actual reflection of that services that you provided. We want to avoid bias or subjective language, right? We want to make sure that we're aware of our own biases. We want to make sure that we're aware of what we believe in, our personal beliefs, right? Because again, those things can cause us to have immediate reactions, right? Or immediate mental associations to certain people, places, or things, right? So we want to avoid those things at all costs. And the best way to do so is to know yourself, right? We want to use subjective language, make sure the client understands the language that we're utilizing or whatnot, and explaining clients in a manner where they can and they can um, understand what we're saying. And we want to maintain secure records. We want to make sure that our records are secured, and we're following HIPAA regulations, and we're keeping confidentiality of those records so a client's PHI can be protected. All right, let's talk about service coordination. Okay, how we actually coordinate our services and make sure our clients are attached and linked to sources that supports that they need. So, service coordination, linking clients to services based on assessed needs. Again, we're going to complete that assessment that we talked about earlier in our course or whatnot. We're going to assess our clients to find out what they need based on their issues, based on their demographic issues, social, economic issues, based on their relationships and their experiences or whatnot. Having an accurate assessment helps us link our clients to resources that can benefit them, right? And also, we want to ensure there's continuity and efficiency of care, that we're providing efficient and consistent care for our clients so they can actually get to the level to meet their treatment plan and service plan's needs. So steps to service coordination. The first step is always going to be assessment and planning, right? So again, we want to assess, create that clinical picture for our client of their needs and whatnot, and then we want to actually provide a service plan that's going to address all the issues that we deemed appropriate from that clinical picture and that assessment. Next is referral and linkage. We want to refer our clients to services that can help actually alleviate or decrease the issues that they're having in those areas that have been identified in the assessment, right? And link them to those sources or whatnot so they can actually connect and be utilized. Then we want to monitor and follow up. We want to make sure that we're monitoring progress and we're following up on anything we need to follow up to make sure those linkages are connected and are being used for the client's benefit. Next, we want to build partnerships with other providers. So we want to make sure that we're connecting with other providers. Again, the interdisciplinary team is very, very important. Helping our clients actually build those bridges to linkages and referrals are important. So it's important for us to build partnerships with other providers so that we can have those linkages and get other information and consult with others to make sure that our toolbox is full of services that can be effective for the client. Effective communication and shared goals, right? We want to make sure that we're definitely have effective communication and we have shared goals with our clients because we're working as a team with our client, making sure that we're building autonomy, making sure that we're helping our clients reach their goals or whatnot, and get the equity that they need to actually sustain recovery or sustain that level that we're trying to get them to, right? We also want to navigate our clients throughout the systems and whatnot. We want to help our clients to navigate whatever barriers they have, advocate for our clients. We want to make sure that our clients are able to navigate the system that we're linking them through so they can actually successfully use those resources. Finally, barriers to coordination, right? So system fragmentation. There are holes in systems, right? There's fragmented systems. There's systems that don't have easy access, that are hard for our clients to actually navigate through or whatnot. So those can be barriers to coordination. We want to help our clients navigate through those barriers and those fragmentations or whatnot, so they can effectively utilize those services. Limited resources is a huge barrier, right? Because again, sometimes there's limited resources for certain issues and certain problems, and we want to make sure that whatever resources are available for those issues, that we have the ability to link our clients to them, right? Client resistance or non-compliance. Remember, some of our clients are coming to us from backgrounds and history where they're not very consistent, right? And they can be ambivalent to change, right? And resist change or not comply with things that we need them to do to actually attach them to those sources or resources to make case management effective, right? So those can all be barriers to coordination. It's going to be our job to help our clients navigate those things, use the strength-based approaches to actually help our clients the motivation to increase to be compliant, right? And again, create that clinical picture where we know exactly what our client needs, so we can link them to those resources and services.